My name is Dale Olson. I live here in Brookings, South Dakota. My wife and I moved up here in 1975 when I went to work for 3M company. And I thought we'd be here 3, 4, 5 years and then go on to something better, and found out there really isn't a whole lot better. We like it here. I had pain in my thumb. I couldn't hold on to things, and my wife had worked here at the hospital since 1983 when we moved to town. She said, "Well, why don't you go see one of the doctors at the hospital?" They hooked me up with Dr. Holmoe, and eventually, on the 4th of August, we had the repair done. I'd like him. I didn't realize he was relatively new here, and since I didn't have much, the only contact I had with the health system was over at the clinic or the emergency room here, and he knew what he was doing. He knew what to look for. He ordered an X-ray right away so that he could see where and what we were dealing with. It's osteoarthritis, I think, and there's no cartilage left between a couple of bones, and that brought things together. And of course the tendon was longer, and it doesn't naturally shrink, so it kind of spread out so it would be the right size, but it hurt to do that. He did injections into the joint, and he fitted me with a brace that wrapped around my hand and held my thumb sort of rigid so it wouldn't move around. He was thinking maybe that'll be enough, but it just got worse and worse. But the first 2 or 3 injections after he was done, it was probably 2 days, and I was back to pre-thumb hurt time. This is a Medicare thing. You got to wait 90 days or whatever. The time limit is there, and that's what we spaced the appointments on. And it removed that scratchiness and the hurt for almost the whole time. It was maybe the last week or so that I could remember why I was going to see Dr. Holmoe. I asked him if we could get it fixed, because he'd explained the procedure. I thought it was something I was just going to have to just tough out, and he said, "No, we can fix that." He needed the MRI so that he'd have a better picture of my thumb, and then he needed some tendon to make the repair, and he wanted to see if I had what he needed or if he was going to have to try something else. It wasn't like the other 2 or 3 that I've had. I had one way, way back here, back in the old hospital, and then I had one done at the VA for something else. But this, it was good. The technician that took me back there, she told me exactly what was going to happen, and she said, "This will be a good experience for you," and it was. Oh, really good. They were really fun people to work with, and to me, they appeared to know what was going on, and they took good care of me when I was there. Asked me what kind of music I wanted to listen to, and I said 60s folk music, and so that's what I got. Just since they took the stitches out, and I've been moving it. It's better. I'm getting a lot more freedom with it, and things that hurt right away back up in here. Oh, it hurt so bad, and now I'm good to go. Yeah, everybody's nice. They're nice. They're personable. They're competent. I think. In my humble opinion, not being a medicine man or anything, but. Yeah, they know what they're doing. They know what they're talking about. Everybody here wears a mask, and people that come in wear a mask. take your temperature to make sure you're not sick, tell you if you're not feeling well, stay home. We don't need that here. And when you're better, then we'll get in and look at you. It's a hometown thing. We live here. We've lived here since '75. We got more modern and could afford the nice equipment and up-to-date stuff. Why? We got a lot of friends that go to Sioux Falls, and they're kind of whining about, well, I've got to drive all the way down there. And why don't you do it here? Well, I don't know. I've just been doing it down there. And yeah, it was a hometown thing.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.